Post-Wildfire Contamination Panel, Local Perspectives Panel, Dr. Ashraf El-Sayeh, Dr. Zaldi Tan, and Have a Heart, Save a Heart's own Dr. Nicole Weinberg. Dr. El-Sayeh is a board-certified pulmonologist who has been involved in many research protocols targeting post-fire intervention and toxic mediation, as well as starting a wildfire relief clinic at St. John's. Dr. Tan is a board-certified gerontologist who recently published a paper in the Journal of the American College of Cardiology titled Emergency Encounters During and After the Los Angeles Wildfires that has been making headlines nationwide. Panelists, please come to the stage.
Thank you so much. We have Dr. El-Sayeh and we have Dr. Tan. Hello, how are you? I am here to just moderate. I'm not an expert here, but I thought we would talk about, so the format will be I'll start to ask questions and then we will have somebody in the audience with a microphone that we'll start passing around. Really, we want the questions to be dictated by you and how the conversation goes through this, but I'm just going to start off. Dr. Tan, you had a very well-received, nationally well-received article that was published in the Journal of the American College of Cardiology recently. Would you mind going over kind of some of the interesting points of that? I did highlight a little bit as an overview some of the initial findings about the hospitalizations after the wildfires, but then there are some like interesting other tidbits that we were looking at with the different chemistries.
Yes. So what we were interested in is to look at the rates of hospitalization and the patterns of emergency room visits after the wildfires. So Cedars is about 18 miles from Altadena and about 10 miles from the Palisades. So it was kind of in the area where we get some patients from both fire areas. So we were interested in looking at the hospitalizations from January 7th to April 7th, so that 90-day period during and after the wildfires, and comparing it to a 4-year period before the fires, so 2018, 2019, 2020, 2021, and then also looking at the, of course, taking into consideration COVID and other factors. So the interesting thing there is that when we look at emergency room visits in our emergency room, we found that there was, the number of visits were similar. So it's not like a lot more people showed up in the emergency room, but the interesting thing is that the number of people who showed up for lower respiratory symptoms, cardiovascular, AMI, ACS, were quite a bit higher compared to people, to the patients who showed up before. So to us, this is really telling, right? That the acute effects of the wildfires are really showing up in how many people are getting sick and getting into the emergency room. So of course we did not look at it mechanistically, but others have, and really what's been shown is that wildfire exposure doesn't only have long-term effects, but also acute effects, which I'm happy to talk about also in the future.
And Dr. El-Sayeh, you have a wildfire relief clinic that you opened and were on the news about when the wildfires were going on. Can you talk about some of the things that you saw in clinic and also some of the things that we should be looking for in terms of keeping ourselves healthy and moving forward from your experiences with the wildfire clinic?
Yes, thank you. So at St. John's, we did start a wildfire relief clinic, and similar to Cedars, we had a lot of patients from the Santa Monica Palisades area, the Malibu area, but I had quite a few patients come in from the Altadena area as well. And we saw very similar. So patients that have underlying lung or heart disease were the most affected. They would come into the clinic with exacerbations of either asthma or COPD any cardiac issues that they have. So we saw that almost immediately post-fire, whether they went to the ER or urgent care, and then they came to us to follow up with us. It's been a year out now from the fires. We're still seeing some long-term or longer-term issues with cough, with ongoing shortness of breath. And then part of the clinic, we treat first responders. So, the firefighters, the LAPD and CHP that were all deployed to the three areas, Malibu, Palisades, and Altadena. We're still seeing, effects with them, and I'm still seeing quite a few patients with them.
I'm sure there are the acute effects that you see, then there's the subacute, and then there's the long-term effects. Could you kind of stratify out for us what maybe some of the differences or some of the things that, I'm sure some people are moving back to their homes, so then there's maybe different things that come up, or some people, the seasons change and then people are outside, or the rains come and then there's different things that kind of crop up.
So this is a crazy time. So, first of all, it's a massive fire. It's the largest urban fire in the history of the United States. But at the same time, there's a big wildfire component. So the wildfire component is where we saw a lot of the immediate problems. Patients that will come in with exacerbations, as I mentioned, patients that have, very high allergies will come in with problems with that, patients that have asthma, a lot of patients that have asthma, children to, the elderly. That was probably the biggest number of patients that we have. As time goes on and these exacerbations are treated and the patients feel better, the problem now is a little bit different. So it's not so much the smoke that they initially inhaled or the fires that were burning. It's more of what we call the VOCs, the volatile organic compounds that are left over after the urban part, after the homes burn down, after the cars burn down. The best example that we have of that, at least in the United States, is the World Trade Center. Although it's a smaller square footage, it was a big building, very tall buildings. So what we see from that event is the best that we have to compare it to. And I can tell you that with the World Trade Center, about 25% of the first responders and 25% of the victims are still receiving care now, almost 30 years later. So I'm predicting that we will see that again. The good thing about, if there is a good thing about the fires that we had, is a lot of people were able to evacuate, and a lot of people were able to move. With the World Trade Center, unfortunately, if you lived in Manhattan, you're kind of stuck in Manhattan, no matter what. So I think a lot more people maybe would have been exposed there than they are now, but we're still going to see some long-term effect. And the long-term effects are, depending on how in-depth we want to go, it's really in response to these organic compounds, lead, asbestos, hydrogen fluoride, hydrogen cyanide. There's a whole list, fluoride, lithium. So there's a whole list of these organic compounds that became airborne and ended up in the soil, ended up in the ash that we still see. And those have the potential of causing long-term damage, long-term pulmonary damage, cardiovascular damage, pulmonary fibrosis, lung cancer are the biggest issues that we have to worry about. And of course, with lead has its own set of problems, with neurologic problems, pregnant women, breastfeeding women, children returning to the schools. So it's not the best of scenarios right now. Now, again, some of the Palisades, some of the homes are newer, so there was less lead, less asbestos, but they still had some very old homes, and I think Altadena has a lot more older homes there, which are going to face that problem long term.
I just want to add that in addition to what Dr. Al-Sayegh said, when you think about what I said about emergency room visits, right? So the respiratory, I think it's pretty understandable. Obviously, if you have hypersensitivity, you have asthma, COPD, but AMI, right? Why would you have more heart attacks because of this? Well, if you look at the literature, you'll see that exposure to wildfires, PM 2.5, increases oxidation, it increases inflammation, it activates the inflammatory system, it activates the platelets, it destabilizes plaques. So not just the stress of being exposed to a wildfire or potentially evacuating, it actually has effects on your physiology. So people in the acute phase, it's the people who are vulnerable, right? Who have clinical or subclinical coronary artery disease, or people who have respiratory issues. Okay. Older people, children, pregnant women. So those are the ones who are most vulnerable in the acute phase. But the long phase, all of us are vulnerable, right? Because these exposure to wildfire has been shown to increase metabolic syndrome, hypertension, exacerbate congestive heart failure, cancer. So all of that is a long-term effect, but it really has the acute phase and then the chronic phase. So right now we kind of have an idea of what happened to the acute phase, and probably most of it has dissipated, but the chronic phase is the one that's unknown, right? Because wildfires are so episodic. Most of the studies on exposures and disease are done in polluted countries, right? Or looking at, ambient pollution, which is not the same as a massive dose of pollution, because at some point it will disappear in your blood, so it's not detectable anymore. But what long-term effect does it have? So that's an area that we're actively investigating.
Well, thank you all very much. I just want to commend the organizer on an excellent conference. I'm Hazem Al-Maligi. I'm a surgeon, vascular surgeon. I was talking to Nicole early that initially I felt it is not the classic way of submitting the participating, because it's a ticket and trophies and stuff like that. But it came extremely a good conference. The focus is not only good for women. Actually, this whole presentation is appropriately applicable to men. And I want to say that we all know how bad the pollution is and the fire is. You are the governor of California, or you are the chairman of the American Medical Association. What do you want us to do?
There you go.
Fortunately, right now, I'm not either of those. I've been asked that question many times by patients, and it's much easier to give an answer than it is to actually really follow through. And what I mean by that is I live in the Palisades, so I lost my home. And it's very easy for someone to come and say, well, the safest thing to do is to move. Pick up, move, and go somewhere else. That isn't reality. That's, I have children, they go to school. We have jobs. Some people, granted, have enough money to be able to move and have a remote job. Not all of us can do that. So I don't know what the answer to that question is. And unfortunately, there is no correct answer. The hope is that everyone follows through with what they're supposed to do, clean the soil, clean, the communities like promised, and help rebuild. And the faster we rebuild, and we were just talking about this earlier, part of the problem with these organic compounds are they're in the soil, they're in the ashes, they're in the dust that are in the homes that are still standing. So part of the safest thing to do, besides clean up the homes that are standing, is to start paving the empty lots. And the sooner we do that, the safer it's going to be. So, they promised a speedier permit process. I tell you, I haven't seen that yet, but hopefully it happens. And the only advice that I would hope they will follow through with is to help people rebuild as quickly as possible, because once everything is paved, it's going to be much safer than just empty soil.
Well, thank you very much. Just one last comment. This conference, I believe, can be a forum for raising the voices on behalf of healthcare professional and the patient to the regulator. And I urge you all to embrace that. And we all encourage you for that. Thank you very much.
We have an online question regarding the how long the acute phase lasts, and I'll say the second question.
Acute phase. So the acute phase typically lasts a few months, so I think we're past the acute phase. But if the question has something to do more with the toxins or the exposures, it really depends, right? So the PM 2.5, which is the one that's most studied, that's mostly dissipated by now a year later, right? But the things like heavy metals, for example. So one of the interesting things, I don't know, it's discussed here earlier, we're not only dealing with wildfire, right? We're dealing with WUI, wildland urban interface, which is different from just burning organic compounds, right? It's as I mentioned, asbestos, batteries, insulation, houses. So the exposures or the contaminants are quite different. So for example, in wildland urban interface, which is what we had in Altadena and Pasadena, there's a lot more heavy metals than what you would get in a straight, wildfire event. So, and heavy metals are known to hang around for a year or more. And sometimes in fact, in one study, the levels don't peak till 1 or 2 years later because of it stays in the soil, and then with rains come leaching, and it comes to the surface again with runoff. So it's one of these things where the acute phase may be, for the PM 2.5, it's only a few months because, you have the stress of all that oxidation, inflammation, all that stuff. But the longer term effects may be much longer because there will be peaks, as soil leaches and things come up to the surface. So that's kind of, depends on what compounds we're talking about.
Are there certain biomarkers in the blood that you look for to indicate toxic levels of chemicals?
So we have a partnership with the fire department. At Cedars, we have a research and a clinical pathway for our first responders. And for the research part, we've seen close to 1,000 of our brave firefighters. In the clinical pathway, we've seen about maybe 200-300. So we will be checking like blood levels, but most of the time, when we ask our experts in these fields, the toxins don't last in the blood too long. So the best thing is if you have pre-exposure and post-exposure, remediate post-exposure blood. We have that for the general population because we have another large cohort called Embark, which are LA residents that we started during COVID. So we have pre-exposure and post-exposure blood, but typically they don't rise very high for very long. So that's the challenge, is that the detectable limits are not, at least in the blood, are not long lasting. So that's why it's hard to say, you've been exposed and your lead level has been elevated for a year. In the environment, it might be, but not so much in the blood, unless you have a really massive exposure.
You answered my question, but Cindy Johnson, are there any studies being conducted though, even at these different levels? Because what we're hearing in the news, and I'm not in the medical profession, so I'm sorry if this sounds very simple, but what we're hearing is, oh, there are particulates in the air. Oh, you're breathing it all the time. So if we're constantly breathing it, and this is constantly being put into our system and our blood, then is there even an effective way of testing? And is there anything in process to do so?
What you're saying is correct, but I think the media is not very accurate when they're explaining this. So all of these things, lead, chromium, whatever, nickel, all of these we have all the time everywhere. But in a certain form where they're covered with metal, they're safe. So they're all over your house, but they're at safe levels where you will not, yes, you may be exposed to it, but it's not harming you. Once it burns, and once the outer coating burns on whatever the handles of your cabinets, I mean, it's silly where all these things are, in the foam of your couches, in your mattresses, in your cars. Once it burns and that coat goes away and it becomes airborne, that's a whole different ballgame. So yes, we are exposed to it all the time. We're exposed to it in this room right now, but it's not at dangerous levels where any of us have to worry that we're inhaling it right now. But, and again, if we're talking about a one home burning down in Santa Monica, it's not a big deal. This is a completely different, unprecedented situation where 3 entire cities burned down. So, these are thousands of homes and buildings and cars. So all of this being airborne now becomes a problem. It's not so much, yes, we are always exposed to it, but not to what we're exposed to in post-fires.
I had a question for anyone on the panel. For those of us who have children who went back to Palisades High School after a year of being at the old Sears building here, they did independent environmental studies which showed that everything was safe. But for us parents, if we know there's still exposure because of everything you've said, what can we look for in children or grandchildren that maybe signs that there's something going on? I mean, teenagers are exposed to everything from screen time to, wireless ear. They're exposed to so many things, microplastics. How can we differentiate the environmental fire as well? Because this is right in our backyard here. So if there's any signs, symptoms us as parents should be looking for, it would be good to know. Thank you.
I can go first and you can finish, but again, this is a little bit more difficult to answer because we can take every heavy metal and look at all of the clinical features that a human being can show. With every single heavy metal, it's going to be something different. But honestly, the big ones are something that we've mentioned over and over. If your child has asthma and they're having more exacerbations than usual, God forbid if any of your kids have any kind of genetic heart issues and you're seeing more problems from that than usual. The big one really that people are worried about is lead. Lead is another one because there's a lot of older homes that had lead. Lead toxicity, you have to be exposed to it for a long period of time, and it's got to be a high level of lead that you're exposed to for at least, what the published papers and books say is at least 30 days. And when you're exposed to it, and if your lead levels are high enough, it's really neurologic issues. It's confusion, inability to focus in school, which for a teenage kid is not a very smart answer, but neuropathies, things like that are what you see with lead. I urge, with lead as well, we have to be careful in pregnant women and in breastfeeding women because it can go through the breast milk, and in pregnant women it can be very dangerous for the growing fetus. Those are the metal or heavy metal things that you have to think about. Now, again, you can literally look up any heavy metal and see what those warning signs are, but it's almost impossible to narrow it to a few features. The one thing I want to point out, and I always mention this in every one of my talks, the immediate exposure is horrible. The volatile organic compounds are horrible long term. But something that's always overlooked or not discussed is the mental aspect and the psychological aspect of what these kids went through. So if we're talking about specifically about kids, from grade school, all the way to college age, they will have some psychological effect of these fires, and the younger they are, they exhibit those problems, the depression, the anxiety, the fear, in different ways than an adult would. So that's something that, in my opinion, is even more important to concentrate and to look out in your kids, especially the ones that once people start moving back. A simple question that my son asked me, which makes logical sense, is, well, if we move back, what's going to stop this from happening again? He's right. And I don't have an answer for that, but that's a way of expressing their fear. It's just a random question that he asked. So I just urge that everyone be careful of that and to look for that.
Yeah, I don't have much more to add from Dr. El-Sayed. I agree that sort of the acute effects have passed, but the long-term exposure, I think that's one thing we need to watch out for. We talked about soil, right? Soil and water, right? So those are the sort of the repositories of all these, compounds that could potentially be toxic or carcinogenic. So long term, we will need to find out what happens to LA residents who have, so for example, in our study, we asked them, where were you during the Palisades fire? Where were you living, and did you have the luxury of moving to San Diego for a month after the fire, right? And relocation is the most effective way of reducing your risk of exposure, but not everyone, as Dr. El-Sayed mentioned. But long-term effects, I think, is definitely important to look at. So again, just because a place has been cleaned and it's been certified doesn't mean that it's entirely free of toxins. So it's important to look at that. For children, particularly, like exposure to soil, like ingesting soil or inhaling soil, because children play in the dirt. So I think that's something that you might want to be careful about. I mean, I was telling Dr. El-Sayed that if I was going to build my house in Palisades, I'd probably pave a lot of the surfaces, because again, grass is beautiful, but I don't know what's going to be in there, especially with rain and leaching. So it's something to think about long term. And then the other thing I want to mention is that the most vulnerable in our city or our county are those who have low socioeconomic status, right? Because they spend more time outdoors. They don't have access to N95. So, sir, like if I was the governor, I'll be like, make sure that everyone has access to N95s, because if you're in construction or if you work outdoors and you have no access to these things, I can tell you a lot of workers use bandanas whenever these happen. That's nothing, So having more access to PPEs, I think, is really important, especially for people who don't have the luxury of staying indoors with an air filter on and educating people. There are also a lot of cultures where there are countries where they burn rubbish as part of normal day-to-day life. So some people are like, what's the big deal? We do that all the time in my country. We burn garbage all the time, right? But we know that that's not healthy at all. But, so there's a false sense of security sometimes with these kinds of things.
Do you empower your patients to get HEPA filters in their house or to use the apps, or are there certain things that you validate as good things to get or things that you think are just excessive and unnecessary?
Definitely air purifiers are a good idea. And air purifiers are measured by something called MERV. And the MERV, the higher the number, the more it will stop particles. And smaller particles, the higher the number. So we recommend a MERV of 13 or higher. And those are not very expensive, and they're sold pretty much everywhere. But it's very important to get, you don't have to get the highest number available, but anything higher than 13 is good. Water filters is not a bad idea in Los Angeles anyway. Whether or not you have the fires, I think it's good to filter the water that we're drinking. Again, hopefully, we're kind of out of the acute phase, something that I used to tell patients, and when I speak with cleaning the ash, if you're going to clean the ash and the particles in your house, they have these HEPA vacuums, specialized vacuums for ash. I would use that, not just regular vacuums. What else? If you're, again, this probably hopefully is not any of you guys, but again, we're fortunate, hopefully enough to be able to hire people to do this. But if you're going to clean outside, it's best to wet the dirt so that it doesn't kick up in your face. Those are really the important things, especially, and then the PPEs, the N95, the goggles, everything else, just be careful not to get scammed with everything else. Yeah.
I have a question. How about the hair dyes that people use and nail polish that they use in hair salons and all the sprays? Are people supposed to wear a mask when they're having, all these things happen? Also, people who live under high polar voltage, power lines, what are they? I mean, those are pretty bad, right?
Yeah, I personally don't know about the effects of hair dyes and aerosol sprays. I mean, I'm sure, but you make a good point that pollutants doesn't always come from the outside, right? So it's always easy to say, okay, seal up, stay indoors, close the doors, close the windows, and but you generate pollutants from cooking, from incense, from aerosols, as you point out, right? So it's not the perfect solution either, because some people will tell you, other people will tell you that you have to let your house breathe, open the windows, and let the fresh air in. Well, if it is fresh air, right? So it's sort of a no-win situation if you think about it. But certainly, you have to balance things, depending on what's going on. But certainly, if the AQI, the air quality index, is bad, you should stay indoors and try not to use candles and incense or cook or vacuum and do all, because you're going to be inhaling that. Most of the environmental pollutants are at home, not necessarily outside, unless you spend most of your time outside. So you have to look at your indoor as well as outdoor. And then the other thing with the homes is a lot of homes are leaky, what you call leaky homes, because air is going through. So no matter how great your air filter is, it's only as effective. Somebody told me that the best air filter is that you go to a room that has no windows and you lock yourself in there, right? And just have the air filter do its job, because it's not leaky. But if you have a leaky home, like I do, because I live in a 100-year-old home with beautiful windows that are very leaky, you gotta decide, right, what your risk tolerance is. So, yeah.
Believe it or not, this will be our last question. We have another panel. It's going to be okay.
Hi. This is a question about communities where landfills are, like for your patients that live near Calabasas area, where all the fire areas took the debris, brought the toxic soil and everything, batteries, et cetera, and brought it there. How do you have your patients stay safe within a few mile radius of that landfill? Even though it's not active, it's not burning, it's buried there. And we just are curious about how that can affect heart health and health in general.
Again, I mean, you guys are asking very tough questions, and I wish there were easy answers. There's the unrealistic answer, which is it's best to move out of the area, and then the realistic answer, which is, if there's dust and ash coming from these areas, it's safest to wear N95 masks around them. Are we going to live in a world where we're always wearing a N95 mask? The answer is no, and that's why there is no easy answer to your question. But you're right. I mean, just the trucks driving up Sunset to go to the 405, and I was watching them because I had to, go meet with my contractor a few times, and there's dust and ash everywhere as they're driving. So yes, we are all going to be exposed, and like Dr. Tan said, it's just a matter of waiting to see what comes out of all of this in the future, unfortunately.
Just want to provide a quick add-on. So it depends on susceptibility and dose, right? So if you're a firefighter, unfortunately, it's a very big dose. So no matter whether you're susceptible or not, you're going to likely see some health effects. But if you're susceptible, then that's a personal choice you have to make. Does it really, like people with a congestive heart failure, for example, or a really sensitive lung condition, I don't know if it's wise to stay in an area. I don't know about landfills. I'm not an expert, certainly, but the question is, does it go to the groundwater? I don't know that. I don't know what the science is if you have a landfill, because that's a concern, is that if it gets into the groundwater, then that's going to affect your water supply.
Yeah, I did have what I think is an important point I'd like to make. Robert Murs, cardiologist here. I think evidence-based is important. And unfortunately, a lot of what I'm hearing from you guys is fear-inducing. And so a question I would have is, what evidence do we have that there is heavy metal exposure in our population? For example, I worked outside at my home, which did not burn but had a lot of damage. I got a lead level. It was not detectable. I know I've discussed that with Nicole, not detectable. I know there's been media reports in firefighters of arsenic and other things. But in terms of the patients that you're seeing, are you measuring these heavy metals that keep coming up as something to be frightened about? Are we seeing this, or are we not seeing it? That's kind of my question. And then also, to what extent can we reassure people that need to go on with life?
I can start. So you're absolutely right that the evidence is lacking. And that's why I think we have this forum, right, to activate people, because to accept things on the surface, like it's low, therefore we don't have to worry about it, I think is not the right way to do it. I'm also not saying that we should all be fearful and move out of LA. I don't think that's what we're saying here, right? I think what we're saying is that be vigilant. And as healthcare professionals, for those of you who are practicing, it's our responsibility to monitor people's health. And if you're seeing a pattern, to report it, because that's really the only way. So at least our Cedars, our small contribution is that we do have these study, the Embark study, where we're going to be looking at people long-term, right? These are LA residents who we have pre-exposure blood, post-exposure blood. We have information on what zip code they were in, where they were when the fires start. So unfortunately, that evidence is going to be years in the making. But hopefully, years from now, maybe when I'm retired, we'll find out what really these effects are, and that will change policy. Research is what drives policy and change. Right now, we're kind of flying blind a bit, but this is an opportunity. By the way, what I was going to say is that World Trade Center, as referenced by Dr. Al-Sayegh, do you know when they started studying the World Trade Center exposure? 10 years after 9/11. That is, I think, shameful that we didn't take that opportunity. Otherwise, we would have had a lot more information now that we've been exposed, right? But there was no study that was, at least not a big study, that followed the first responders from 9/11 until 2011, 2012. So that's one thing we're trying to change, is to get the first responders, the LA residents, study them and see what's going to happen to the exposures. And then hopefully our children and our children's children will be better off than we are.
Okay, Drs. Tan and El-Sayegh, thank you so much. It's a difficult subject to cover, and we are very, very grateful. Thank you for your time. Thank you.